The idea of this year's Second Chance Conference really focused on the importance of assessment, that we have a lot of folks in the criminal justice system who certainly need a lot of types of intervention. It is really important, if we're to have successful outcomes and if we're to ultimately lower recidivism, that we make determinations about the different types of risk factors or issues that people are having and the different types of needs that they have, the kinds of things that relate to the reason that they've committed some type of crime.
Well, it's really nice to know that this is a federal priority and that our national government understands what it's like. You have to work a lot harder at rehabilitating somebody than just pronouncing a sentence. And so if you're willing to take on that work, it really makes a difference in the community.
I really hope that they will take away the feeling that I will, and that is that reentry has really become a big deal. I had the privilege of writing the first solicitations for the Second Chance Act. And a lot of folks will remember our first conference 3 years ago when we, in 2009, were able to make 50 awards, very small. Then last year we had probably 300-400 people there. I remember when I walked into the ballroom at the beginning of this conference and I looked at all those tables and all those chairs, over 700 people. And then the fact that the Attorney General and the Secretary of Labor and Congressman Danny Davis, who we all know as Mr. Second Chance, Shaka Fatah, and all the people to indicate that this is a big deal. It really has made an impact.
The majority of individuals will have either an alcohol and or drug use disorder coupled with mental illness that you're working with, and we need to understand how to be responsive to those particular circumstances if we're going to bend that curve. When you have a mental illness and or substance use disorder, it may be in part the reason that you enter into the criminal justice system, but it is always a complicating factor in your exit and successful reentry.